In line with its mission to contribute to global peace and prosperity, the Global Center for Policy and Strategy, a Nairobi-based think tank, held an interview with Ambassador Adriana Midamba, GLOCEPS Associate, an academic at Indiana University, and a United States Department expert on Global Health Program for Eastern Africa. This interview precedes the 39th African Union Summit on Advancing Universal Health Coverage, which will be held from February 12th to 15th, 2026, in Addis Ababa, Ethiopia. Universal health coverage. How can governments strengthen universal health coverage to ensure healthcare becomes affordable and accessible for all?
The World Health Organization has instructed every single country in the globe to produce 15% of their GDP towards healthcare coverage. So number one, our fellow East African governments need to provide, I would say, close to 10% of their GDP towards healthcare coverage. Number two, the insurance companies need to be restructured, where we're not focusing strictly on chronic illnesses. We're focusing on coverage for everything. You also can look at other models which have been effective in South Africa, where they have used community pools, right? So there are ways that you can really tackle this problem, both in the rural community, where you're using the pool system, or even here in places like Nairobi, where you're in urbanized areas. Employers also can contribute more to their employees, and then we'll really see, I think, a great increase of the universal coverage.
Health system coordination. What practical steps can Eastern African countries take to build a strong, well-coordinated healthcare system that effectively serves everyone?
The donor community needs to really collaborate together. And under the new initiative with Kenya and the U.S. State Department, which was signed in December 2025, I think this will provide a great model of a bilateral agreement where the donor and the country are working hand in hand together. Both have contributed to the success monetarily, also through policy. The ministers of health are really able to not only own in on the challenges, but also take a stronger leading role with working with the donor community and say, you know, instead of having 10, why don't we maybe make a consortium where we're all working together and we all have one goal?
Cost of healthcare. Which insurance models and health financing strategies have successfully reduced out-of-pocket healthcare costs for families, and how can these be expanded?
I think in order for these models to be effective, the government has to put a stronger emphasis on health care and universal health care by increasing the GDP. Kenya is producing the highest amount, 4.5%. Some of our neighbors are doing maybe 2%. So it is standing out as a regional leader, and we applaud you. But I definitely encourage to go to 10%, and then we will see that we can avoid some of these challenges.
Digital health and technology. How can governments harness digital health and AI to improve care delivery while protecting patient data and ensuring inclusion of vulnerable communities?
So we need to make sure that, number one, regulation is upgraded. And there are tools that you can make sure that you're meeting the regulations to ensure the safety and data protection of the individuals, of the country. But we also want to make sure we're keeping human capital, right? We don't want to be so AI-driven that we forget about the many people that are employed through the healthcare system. This also brings lots of opportunities for young Gen Z millennials in Kenya who are equipped with AI skills. You know, maybe they can build apps. It's very exciting. I look forward to hopefully working in this field one day where we're going to see a transition from paper to actually, the computer for our healthcare system. So I'm very excited.
What opportunities does the Social Health Authority present for improving healthcare access for ordinary citizens? And what key reforms can support its success?
For the SHAR to be more attainable, greater commitment from the Kenyan government, right, for 10%. And then also you could bring the business community involved as well, because they are the employers of all of our great Kenyans here. So they also need to contribute more. So more needs to be taken out from the pie. But I think what we've seen in Germany, Japan, Sweden, Finland, is that the government mandates that every person, every citizen is a part of their universal health care. Kenya, what I was shocked to see is that less than 50% are actually a part of this, and that's in Nairobi. In the rural communities, it's even less. So we have maybe mandate that every person takes part in this, or at least get over the 50%, closer to 70%. Then I think then you could see the real utilization of that. But I think it's a tremendous step forward, and I think it just has a few more inches to go. But I'm rooting for it, and I'm rooting for Kenya.